So for this mini teach, we're going to be talking about the Brunnstrom stages of motor recovery. Within the Brunnstrom stages, there is 6 of them, so 1 through 6. And within these stages, they use tone, spasticity, synergy patterns, and all that to kind of see where someone is after a stroke. So generally speaking, to give some background knowledge before getting into the different stages of the Brunnstrom scale, let's talk about tone, synergies, and spasticity. So for the synergies are generally a group of muscles that we use to create a specific movement. Generally, these movements are in diagonal type patterns, and with synergies, we often see D1 flexion, D1 extension, and then we also have D2 flexion, D2 extension. The most common with strokes often seen is D1 flexion of the upper extremity, and then with the lower extremity we often see D1 extension. So generally speaking, with the synergies, they are more prevalent within stages 2 through 4. To start off with, we are pretty flaccid right after a stroke, and then towards the end stages, we tend to see those synergies go away. As far as spasticity, it often begins in proximal muscle groups, so being like the shoulders, the pelvic girdle, so basically hips and shoulders. Now, oftentimes with spasticity, what the difference is between spasticity and tone is spasticity is with the change in how fast we move a joint, that muscle is going to contract a little bit and kind of fight that motion. So a lot of times with spasticity, we have to be very careful, and there are certain types of PNF and NDT techniques we can use to either inhibit the tone or facilitate the tone. Now, as far as tone goes, there's generally low tone and high tone. So depending on where they're at in the stages of, after, like I say, a stroke, we could either have low tone or high tone. And tone is basically the tension that you have in your muscles at rest. So if you're someone who tends to have a higher tone, we can test that by slowly moving a muscle or a joint through a range of motion to test a muscle, and we see the resistance that it gives us. So generally speaking, someone who has low tone, someone who is flaccid, is gonna, let's say for elbow flexion, for example, it's gonna be very easy for us to move that arm in extension and in flexion, but the higher the tone goes, the harder it is, and the more they're going to resist that motion that we're doing. So there's a little bit of a difference between spasticity and tone. Spasticity is more about the speed of the motion, and then if there's someone who has high spasticity, with the higher speeds and whatnot, they're going to fight even more and more and more to say maybe get that elbow extension when we are in flexion. Versus tone. Tone's a constant thing. It never changes. So let's go into the 6 different stages of the Brunnstrom motor recovery. So with stage 1, we often see flaccidity. So right off the bat, their stroke patients are going to be low tone, no voluntary or reflex activity is present in the involved extremity. So depending on whether or not you have a left side or right side stroke is going to determine which portion of the body is affected. Okay, so moving into stage 2, spasticity and tone starts to kind of increase here a little bit. So we're starting to see some of these synergy patterns that we talked about. So oftentimes it's going to be that D1 flexion of the upper extremity followed along with the D1 extension of the lower extremity. With these synergy patterns, they're going to be mild at first. So they're going to start to appear, we're going to start to see them, and then when we move further along, we're going to get into stage 3. Now, stage 3 is going to be the point at which spasticity and tone reaches its peak. So movement synergies of the involved upper or lower extremity can be performed voluntarily. So generally speaking, this is going to be pretty hard to get you out of. So when it comes down to what do we want to do we want to facilitate or do we want to inhibit? Generally speaking, once we get to this point of high tone, we're going to really want to work on inhibiting to break out of whatever synergy pattern our stroke patient may be presenting. Moving along into the fourth stage of spasticity, this is where we start to see it decrease a little bit. So generally speaking, we're going to go from, I would say, about like, it's kind of like comparative to say stage 2 where we start to see the synergies and everything develop. Now we're starting to see it's kind of like a U-shaped graph. So starting off pretty low tone, pretty flaccid, we're going to reach our peak, and then we're going to hit that point where we start to decline, or not so much decline, but actually get better. So using that U-shaped graph is going to help kind of, put an image on it and help you see it a little bit better. Once we're starting to get better and we move into stage 5, which is just before we finish up, spasticity continues to decrease. We're seeing less synergies. We're seeing more voluntary movement of those extremities that are stuck in certain synergies. We're kind of limited, but generally speaking, movement is possible. Now, once we get into, say, stage 6, spasticity is essentially absent, if you will. There might be some trace amounts of spasticity depending on, like, generally speaking, because those proximal muscle groups are going to be the ones that are affected first. Usually we tend to see those get better towards the end. So as far as isolated movements and combinations of certain movements, we're able to do so. So certain diagonal patterns are much, much easier to complete. Moving along, there is the 7th stage of the Brunnstrom scale, and so this is basically returning to normal function. So no more spasticity, all fine motor skills are intact, and we're able to go about our normal ADLs and activities and all of that. So as far as like what type of treatments and things we can do depending on the stage of the stroke that we're working with. So at the end, I'm going to go ahead and write down 5 quiz questions for you. It's going to be 5 different scenarios, and each scenario is going to be a different type of stroke patient who is in a different stage of the Brunnstrom motor recovery. So as far as that goes, we're going to be able to implement what type of exercises. I'm going to give you some examples. Do we want to inhibit the tone or do we want to facilitate the tone? So we're going to be using PNF and NDT techniques to go ahead and kind of correlate everything together. Let's see, what else do we have here? So yeah, that's pretty much it. And one extra thing to note too, that's really good to pair along with the Brunnstrom stages of motor recovery, is looking into the modified Ashworth scale for grading spasticity. So one way we can kind of help get an idea or a picture of how much spasticity our patient is having is using this scale, and with this scale we're going to be using numbers 0 through 4. So we're going to implement this in some of our quiz questions here, and generally speaking, grade 0 is going to be no increase in muscle tone. So this is going to be pretty much flaccid. So this is going to be your person who either has normal functions or generally low tone. So as far as number 1 goes, it's going to be a slight increase in muscle tone. It's manifested by the catch, and as we increase that speed of the movement, a 1 plus is also going to be kind of very similar, but generally it's just less than half of the range of motion before we get that spasticity. Number 2 is going to be more marked increase in muscle tone through most of the range of motion, but we're still able to move a little bit. Once we get into level 3 of the Ashworth scale, we're going to be getting a considerable increase in muscle tone. So this is going to be passive movement is very difficult. We might be able to achieve some range of motion, but generally speaking, that's going to be pretty tough. And the number 4 is going to be rigid. So this is going to be like your stage 3 Brunnstrom. Alright, so they're going to be stuck in a synergy. It's going to be extremely hard to break them out of it. And a lot of times, often when we break them out of it, they go right back into that synergy that they're stuck in. So I'm going to go ahead and give you guys the questions. Give me your answers and let me know if you have any questions about this little mini teach.